So that was fructose. So how is glucose metabolized? I mean, glucose is used by virtually every cell in our body. So can we allow for I mean, fruits are made up of glucose and fructose combination, but if someone's eating just pure glucose, for example, is it as harmful as fructose to their overall metabolic health?
I think so, in a different way. You said that glucose is utilized by all cells. Glucose can be utilized by all cells. Okay, there's a thing called the Krebs cycle. Hans Krebs described it. It's where fuels go into the cell, into the mitochondria, and get converted into ATP, and adenosine triphosphate, which is the energy molecule of the body. And it's the same energy Krebs cycle that's in an animal and an insect, not a plant. But all living creatures have the Krebs cycle. And the Krebs cycle can equally take in glucose or carbohydrate or glucose. It can take in proteins, and it can take in fats or ketones and metabolize them into the same pathway. So you're quite right, glucose, but it can be utilized by all cells. But all cells in the body, bar three, and are the erythrocytes, the red blood cells, some cells in the lens of the eye, and some cells in the kidney, called the loop of Henle, very thin cells, and maybe the ends of some of the nerves use glucose exclusively. But that small amount of glucose that they require can come from gluconeogenesis, which is done in the liver where you break down protein, or it can come from the breakdown of fats. And specifically the glycerine backbone of the glycerine side chains of a thing called a triglyceride. Glucose is used, but again, as I say, why? People say, I need to have carbs all the time. So, well, actually, why was God so stupid to make us completely dependent on one seasonally available food product? Well, God's not that stupid. I mean, I'm anti-religious when I make a statement like that. But I mean, God made us available, to eat bioavailable, complete foods, which are seasonally available in carbs or all year round in animal-based product. So glucose is an interesting one because, again, the metabolism, the primary metabolism of it is actually pretty simple. We've known about that for a long time. But the secondary metabolism and the other effects of it is relatively new. So when you put glucose into the bloodstream, the blood does everything in its power to get it out of the bloodstream. And it does that under the direct effect of insulin. And then insulin will store it away into muscle as fat, into the liver as fat. And it does that, and just takes it out. But if you keep eating carbs in and in and in, then you end up with chronic hyperinsulinemia, elevated secretion of insulin. And then ultimately, you can only put certain amount of fat into your cupboards, and then that starts flowing it back into the liver. You end up getting more trouble with the liver and storage, and more troubles with fat in the liver and alcohol in the liver from that glucose and fructose metabolism. And then that comes along with non-alcoholic fatty liver disease, of which 8% of 10-year-olds now have non-alcoholic fatty liver disease. Children who have got cirrhosis of the liver or developing it. I touched on something, but someone might pick me up if you're really clever about that. I talked about glucose being associated with fatty liver disease. If you're insulin resistant or obese, then 30% of glucose gets metabolized back into fructose. And that was the kingpin for the linchpin for me when I was working that out. It's called a polyol pathway. And so when you therefore, you not only have people eating too much fructose, you have 30% of the carbohydrate that they're eating getting converted back into fructose. That's the runaway train. So first of all, 30% of glucose gets converted back to fructose. That's that pathway. The rest of glucose is pushed into the bloodstream, into the tissue, under the effect of insulin, which is fat storage. And you can only do that for a certain period of time. Two things I want to dwell on, which aren't really well known. And one is, have you heard of the glycocalyx?
No.
It's the biggest organ in the body. Okay, so most people think, the skin's the biggest organ. But we've got in the glycocalyx is the lining of all of our blood vessels, particularly our arteries and our tiny little arterioles and the capillaries. And it's like this sheath, like these little fingers that actually move the bloodstream along the bloodstream, move the red blood cells, the white blood cells, particularly through the capillaries. And it creates that sweeping motion. Nitric oxide opens that up at the tissue level so the red blood cell can be pushed down the path. Direct effect of nitric oxide. So that glycocalyx is around about 1,500 square meters. It's so much bigger than the skin, because you can imagine the surface of every blood vessel. Now, if you apply glucose to that, it immediately damages it. And therefore, those people who've got diabetes, their glycocalyx thickness in the blood vessels is around about half of what it should be. So the ability to push your cells down the pathway, down the blood cell, down the blood vessel, is damaged by the direct effect of carbohydrate, by glucose. Remembering that 30% of the glucose is converted to fructose, the fructose gets converted to the uric acid. The uric acid inhibits the nitric oxide, which is trying to do that job. So you've got a primary damage to the glycocalyx. You've got a secondary damage to the nitric oxide, which is trying to get the blood vessels open. That's a bit mind-blowing, isn't it? Mind you, I was mind-blown when I found it. And so if you get control of your diabetes and you get control of your blood glucose, then in fact your glycocalyx regenerates very quickly. But those people with chronic diabetes and chronically elevated blood glucose, particularly if they're going up and down like that, have a chronically thinned out glycocalyx. Now, when that glycocalyx is not only involved in this movement, it's also acting as a barrier to stop antigens or abnormal proteins or things across into the tissue. A lot of people have heard of leaky gut.
Mm-hmm.
We've actually got inflammatory gut disease, and proteins, particularly plant proteins, and we'll come along to those, literally get into the bloodstream and then can create the allergic reactions and the sensitivities. And the same thing's actually happening at the glycocalyx right through the entire body under the direct effect of glucose and the anti-nitric oxide effect. So anyway, that's another pathway. So another here's one a favourite one, is a thing called the Maillard reaction.
Before we move to that, Dr. Fettke, do you mind? I have a couple of questions. So you said it obviously thins down the glycocalyx, but is it can it repair itself?
Yes, literally within hours.
Within hours.
Within hours, the glycocalyx will regenerate. So you can have a whole lot of carbohydrate, 50 grams, 100 grams of carbohydrate. It'll smash that glycocalyx. Within 8 hours, probably around 8 hours, that'll restore itself very quickly.
Mm-hmm.
So we've got the ability to turn that around very quickly. But if people are having carbohydrate
all the time,
7 times a day. So it's so you're chronically smashing that glycocalyx.
Is glycation, diabetics are prone to glycation in their joints? And as an orthopedic surgeon, you probably know of that. Is that related to that? Because I suffered with frozen shoulders thanks to glycation, thanks to the diet I was following, thanks to the UK diabetes guidelines. I was eating tons of carbs and I was trying to match and control my blood sugars with insulin. And of course, it didn't work. And I ended up with 2 frozen shoulders, refused all medication. I'm still recovering from it. 4 years on, completely naturally by normalizing my blood sugars, but I'm not quite there yet. I don't have full rotation in either of my arms yet.
Every patient I saw with a frozen shoulder, I would do a diabetes test.
Mm-hmm. Mm-hmm.
And there were a proportion of those that had diabetes. So I'm going to answer I'll answer, you've brought up 2 topics, and I'll answer them sequentially. One's glycation and the other one's joints. So the glycation one, I think, is really interesting. It's a really easy one to understand. And it's called the Maillard reaction, M-A-I-L-L-A-R-D. It's a cooking term. Everyone knows it. When you cook food, it goes brown. So if you get a piece of bread and you put it in the toaster and you heat it up, the glucose in that combines with the protein, caramelizes and goes brown. So in your blood, when you eat glucose, and your glucose goes up, a portion of that goes up in the bloodstream, but a portion of it, about 2/3 of it, goes into the tissue, particularly if your glycocalyx is thinned. So it goes into the tissue, and then under the effect of body heat, you have a combination of the glucose combining with the proteins in the soft tissues, and you have an effective toasting of the tissue. So every time you've got diabetes, your blood glucose spike, you are slowly but surely toasting your brain, your eyes, your kidneys, your limbs. Everything is getting toasted by the Maillard reaction. So glucose in the tissues is not good. Anything above a normal blood glucose, remembering we need some glucose in the bloodstream. We keep that up by this thing called glucagon, which breaks down fat, and it's involved in gluconeogenesis. But it keeps so we've got all these mechanisms to keep our blood glucose at a certain level. We've got these other mechanisms to drag it down so it doesn't get too high. So that glycation, that Maillard reaction, is why you don't want to have any blood glucose spikes, because each time you had a blood glucose spike, you're causing direct toasting, which is largely irreversible. So the glycocalyx, reversible. The Maillard reaction, low-grade chronic inflammation, not particularly reversible. Partially over time. Excuse me. Which comes down to joint disease. If you look at cartilage damage in joints and tendon damage and adhesive capsulitis around the shoulder, if you look at the tissue, you find the end products of glucose metabolism. You find the glycation of the proteins in the tissue. The glycosaminoglycans, which make up the binding tissue within a cartilage, joint cartilage, gets damaged by that Maillard reaction. You don't find the end products of protein metabolism. You don't find the end products of fat metabolism. You actually find inflammation. You might find some traumatic inflammation, but the vast majority of the brittleness of your cartilage, the brittleness of your tendons, is that Maillard reaction occurring at every joint, every tendon, and it's all carbs. So if you look at, I've got a mate who's right into forensic archaeology. And if you look at pre-agricultural skeletons, so we're going back 10,000 years, you don't see the signs of osteoarthritis. I've got so many patients over time. I'll come back to joints as well. Insulin, when you actually eat carbohydrate, you produce the insulin to store it as fat. That insulin has two other effects. One is as a growth hormone. So the most important hormone in the growth of cancer is insulin. The other thing is it's a major inflammation hormone. So that work came out of China in 2020. So not everything bad came out of China in 2020. I say that, you got to think of it as good stuff, which showed that osteoarthritis of the knee in particular was under the direct influence of insulin. So when insulin went up, arthritis and synovial inflammation, which is the lining of the knee joint, goes up. When they reduced insulin, the inflammation went down. Now, I know that paper wasn't written by a low carber, because the Chinese said, we've got to target insulin in the management of arthritis. No, you don't need to target insulin. You just need to reduce carbohydrate intake. The body will produce less insulin. So I effectively just, advise all my patients, have for some years, stop eating carbohydrate. And those people that do that have a major reduction in their symptoms of whether or not it's osteoarthritis of the hip or the knee or the neck or the spine, whatever. They have a major reduction in their symptoms. I've got a friend, the same friend who's right into the archaeological side. He's actually a shoulder surgeon, and he's pretty well had to retire because all of his patients with shoulder cuff troubles, he said, I'll book you in 8 weeks for surgery, but I want you to go low carb keto in the interim period. 80% of his patients cancelled their surgery. Those that didn't cancel hadn't done it. So again, I'm on record for saying I think we over-operate too much as orthopedic surgeons. We're not hard enough on our patients to say you've got to make the lifestyle decision. However, I understand why as healthcare professionals we haven't done it, because we haven't been given the tools. We've been told, I'll go away and eat properly, eat by the food pyramid, go and see the dietitian who's been educated by the cereal industry. Go along, we'll give you these drugs because we've been educated by the pharmaceutical industry. We believe that meat causes all these things because our education has been tainted by the Seventh-day Adventist Church. We've been completely surrounded by what I call disinformation, deliberate misinformation. It's very hard to break out of that mold. But if you actually do give people the chance of actually have a complete eating nutritiously rather than for calories, with a complete amount of proteins, complete amount of healthy fats, micronutrients, then all of a sudden, if you support that person, they get better, and then they tell the next person and the next person, and then Nayiri does it, and she goes, hang on, this has improved my life. I'm going to do a podcast and tell another lot of people. And it's such a powerful tool, because I can guarantee I'm not making any money on this. I can guarantee if you are, you're making bugger all. We're doing, and the people in this space are doing it out of the passion, because it's empowered my life, it's empowered your life, it's empowered our children's life, our family's life, my patient's life, my community, blah, blah, blah. And that community is no longer just here around me in Tasmania, it's nationally and internationally.